I am Alice. Welcome back to Men Health 30, where we do not shy away from the truths about men's health, especially sexual health. There is a question I receive very often on social media, and I am sure you have asked yourself the same. How can I make my penis bigger? Longer? With a larger girth? Sounds familiar, doesn't it? But here is what may surprise you. A survey of 50,000 heterosexual men showed that 55% of men are dissatisfied with their penis size, while 85% of women are completely satisfied with their partners. This gap is not just a number. It shows that many men are judging themselves far more harshly than reality. Science has also proven that body insecurity, particularly regarding the genitalia, can reduce self-confidence, harm relationships, and even lead to psychological disorders. A study in the Journal of Sexual Medicine further found that men who worry excessively about penis size are often less satisfied with their sex lives, more likely to avoid intimacy, and more likely to feel disconnected from their partners. So, what is the actual average erect penis size? What are the warning signs that you should see a doctor? And which methods are truly safe, and which ones are nothing more than dangerous traps spreading all over the internet? Trust me, you will want to stay until the end of this video, because what you are about to hear can completely change the way you see yourself and help you avoid making mistakes that could cost you for the rest of your life. But here is where the real problem lies. Pornography has completely distorted the way we perceive what is normal. What you see on the screen is not biology. It is a carefully staged and highly curated performance. In this industry, actors are often selected because they have outstanding physical appearance and penis sizes well above average. They are further enhanced by camera angles, lighting, and even erectile-enhancing drugs to create a so-called perfect illusion. So what happens? When you compare yourself to these unrealistic images, you will only feel more inadequate, even though, in reality, you are completely normal. A study published in the Journal of Sex Research showed that men who watch pornography frequently report significantly higher levels of dissatisfaction with their penis size compared to those who watch little or none at all. The dangerous part is that you don't even realize you are being influenced. The more you watch, the more you disconnect from reality, and the more likely you are to fall into a vicious cycle: insecurity, comparison, anxiety, and seeking unproven solutions on the internet. So, what is the actual average penis size? And how can you escape this psychological trap? Let me show you right now. So, what is the truth? Listen closely to this number. According to the best available medical data, the average erect penis length is about 13.2 centimeters, i.e., 5.2 inches. This figure is aggregated from dozens of studies on thousands of men worldwide. And here is what matters. Any length within plus or minus 2.5 standard deviations around this mean is considered medically normal. In other words, if you are a bit longer or shorter than the average, you are still completely normal. Only when the erect or stretched penile length is below 7.5 centimeters, i.e., under 2.9 inches, is it defined as a micropenis. And this condition is extremely rare, affecting only about 0.14% of men, roughly 1 in 700. Possible causes include congenital factors, endocrine disorders, certain pelvic surgeries, or illnesses such as cancer. But for the vast majority of men who worry about size, you are almost certainly not in this group. See? The real numbers are very different from what you might imagine. And precisely because of excessive anxiety, many people fall into a dangerous psychological spiral. But today, we are going to focus on men who do not actually have a micropenis, yet constantly feel that something is not right. And you need to know a crucial fact. The majority of men who worry about their penis size are actually well within the completely normal range. The issue is not length or girth, it is excessive anxiety. In medicine, this is considered a form of body dysmorphic disorder, known as small penis anxiety. The term does not mean your penis is small. It means you are obsessed with its size. Men who suffer from this anxiety often spend more than an hour each day inspecting, comparing, and thinking about their penis. For some, this obsession becomes so severe that it seriously affects their work, relationships, and can even lead to hospitalization or suicidal thoughts. This is not a joke. It is far more common and serious than you might think, and there is a good chance that you or someone you know may be struggling with it right now. Even worse, when men start searching for solutions online, they are easily drawn into a maze of vague advice, unproven procedures, and dangerous promises. Many, out of deep anxiety, end up turning to unlicensed clinics, self-proclaimed experts, or even traveling abroad to undergo so-called quick penis enlargement procedures. And the results are often catastrophic: deformities, permanent erectile dysfunction, severe infections, and lifelong complications. Please do not let yourself fall into that situation. If you're struggling with anxiety about your penis size, the first and most important step is to seek help from a qualified urologist or a licensed psychologist, professionals who truly understand and can help you. Do not let those who only want to sell you a miracle take away your health and your confidence. Now, before we go into the possible treatment methods, I need to emphasize an important disclaimer. The North American Society for Sexual Medicine, and NSSM, has stated very clearly, all penile lengthening or enlargement procedures are not recommended, except for men who have been definitively diagnosed with a condition known as micropenis. This means that most of the current interventions are still considered experimental. And what I am about to share with you are options that have been discussed in the urology literature, each with varying levels of scientific evidence. If you are considering any of these methods, remember this: they must be performed under the close supervision of a licensed medical professional to ensure both safety and effectiveness for you. Now, let's go through each group of treatment methods to see which ones are truly safe and which ones you should absolutely avoid. We will divide the treatment methods into two major groups: non-surgical methods and surgical methods. And first, let's start with the non-surgical group, which is generally considered safer and lower risk. Among these, psychological counseling is by far the most important option, and also the place you should begin. Why is that? Because studies have shown that when men are evaluated and counseled by experienced professionals, they gain a clearer understanding of what is considered a normal size, which significantly reduces body-related anxiety. What's interesting is that the majority of men who receive counseling without any medication, devices, or surgery often no longer feel the need for further treatment after a period of time. This is an excellent outcome because it shows that sometimes the problem is not your body itself, but the way you perceive it. Therefore, if you are worried about your penis size, start by seeking professional counseling from a psychologist or a qualified urologist before considering any other intervention. Now, let's talk about the physical treatment methods, the non-surgical options. There are three approaches that are most often discussed: penile traction devices, vacuum erection devices, and penile injections. Among these, only the penile traction device has consistent data showing it can increase length, but the gains are very modest, on average about 2 centimeters, and only if used for several hours per day over many months. The drawbacks: it requires extreme persistence, the results are limited, and there is a risk of numbness, bruising, or no benefit at all. Vacuum erection devices have not been proven to increase penile length. Their main role is to assist with erectile dysfunction, not enlargement. Penile injections are by far the most dangerous option. They yield poor results, carry a high complication rate, and can lead to deformity and permanent erectile dysfunction, even years later. I do not recommend this method. As for surgery, the most common procedure is suspensory ligament release. This only makes the penis appear longer in the flaccid state. It does not increase true length, and it carries significant risks: instability, unsightly scarring, and loss of the natural erection angle. Other surgical procedures, such as skin grafts, the use of. At present, no penile lengthening surgery is recommended unless it is performed strictly within the framework of an ethics board-approved clinical trial. Only in such a controlled environment can patients be fully assured of safety, ethical standards, and close supervision. At the same time, the data collected from these trials is published transparently, helping both doctors and patients make better informed decisions. In summary, you cannot significantly change the congenital length of your penis. Penile traction therapy may provide a small improvement, but it requires a great deal of time, commitment, and also carries risks. The most important and effective step does not lie in procedures, but rather in addressing the anxiety and misinformation surrounding this topic. Before considering any intervention, start with your mindset. Seek out a trained psychologist or a qualified urologist who understands your body, and don't chase after a so-called solution that could leave you worse off than before. Because your sexual health is not just about size. It is also about function, confidence, satisfaction, and happiness. And above all, it is about knowing how to care for yourself with accurate information, proper support, and the truth. Thank you so much for watching until the end. I'm Alice. See you next week, when I'll be sharing the history of penile injections and the real risks, complications, and consequences of introducing foreign substances into the body. Until then, remember this: take care of yourself because you are worth it.